I am Jaya Reggie Mathai, psychiatric nurse practitioner. We have Mabel Vichin, doctor of pharmacy grads, is today with us, and we are going to discuss about alcohol and how alcohol interact or interfere with some of the medications. And there are a lot of medications that interact with alcohol, and the purpose of this video is to provide an awareness on the public about it. Please don't use this for treatment purpose. And before you take any medication with alcohol, please contact your healthcare provider or the pharmacist. Okay. So first we will discuss about absorption of alcohol. When we drink alcohol, alcohol from our stomach and small intestine getting into the bloodstream. And liver is the major organ to work on the metabolization and excretion of alcohol. So liver has got two enzymes mainly using to metabolize alcohol. One is ADH, that means alcohol dehydrogenase, and that convert alcohol into a toxic substance called acetaldehyde. Okay, and another enzyme, second enzyme, it is acetaldehyde dehydrogenase, that metabolize alcohol again to acetic acid and converting acetic acid to carbon dioxide and water. And when we think, like, you have seen that the police stop and check the people whether they are under the influence, driving under the influence of alcohol or not, because sometimes certain amount of alcohol, it is unchanged, unmetabolized alcohol, can excrete through our breath and the urine. So that's what it's like a very minimum amount only. So that's what they use for checking the breath analyzer checking. Okay. So this is the metabolization of alcohol. But there are certain drugs can interfere the production of these enzymes by damaging the liver, or sometimes even they block the function of these enzymes. There are certain drugs are there. So what happened, acetaldehyde is very toxic, and when anything happened to our liver and this acetaldehyde is not excreting and metabolizing, then that is very toxic. What happened when this toxic product increase in our body, we get headache, severe headache. First the headache, nausea, vomiting, then our face is going to be flushed, then what happened, like excessive sweating, then palpitation, then even variation in blood pressure. Then eventually, as how much the toxic effect we have in our body, like that the adverse reaction is going to be increased. Even eventually, if it is too much, can have heart attack and sudden death. So these reactions we call disulfiram-like reaction. Why we are telling disulfiram-like reaction? Because there is a medication called disulfiram. That is the medication we use for the alcohol addict to get rid of the addiction. So, or we call this and-abuse. So when we take this and-abuse, the same reaction happens, like a nausea, vomiting, severe headache, palpitation, and variation in blood pressure. All this unpleasant adverse reaction happen. So that's what we use in people who is addicted to and they don't want to continue it, they take this medication. So today we are going to talk about some common medication that can interact with alcohol, and like incompatible, we should not use this medication with alcohol at all. The first one is
yes, so the first one will start with metronidazole. So that is a very common antibiotic that is used to treat infections or diarrhea or vaginal infections. So if you take metronidazole with alcohol, the most common side effect is abdominal cramps, nausea, headache, vomiting, and you can find a couple of other unpleasant symptoms as well. That is the most important drug.
Yeah, it's same like it's severe adverse reaction like disulfiram-like reaction. What all things when you take like a disulfiram medication, same like a life-threatening situation, even heart attack and sudden death. It's a severe adverse reaction when you take flagyl with alcohol. And plus, it's sometimes over the cup. Some people just go and buy and take alcohol, get flagyl to when they have some diarrhea. So there should not be take alcohol and flagyl together at all. And second medication is
Secondly, we have tinidazole. So that is also an antibiotic that is used to treat infections. If you mix tinidazole with any alcohol or alcohol-containing beverage or propylene glycol, anything of that sort, you can get severe throbbing of the head and neck, throbbing headache, flushing, and so many other related unpleasant symptoms. That is regarding tinidazole.
And same like disulfiram like reaction.
Yes.
Yeah. And
then we have ketoconazole, which is the next in line. Ketoconazole is an antifungal, which is mainly used for treating dandruff as well as fungal infections on the top line. Ketoconazole, if you use it topically as a shampoo for dandruff or so, there's no interaction that's going to happen when you take it with alcohol. But if you take it, but if it's a tablet or a capsule form, then if you take it with alcohol, then you will get there will be severe liver damage, which you can see, and also there will be unpleasant symptoms of headache, nausea, vomiting, and things related to that.
Okay. Yeah.
Then the next medication would be methotrexate. Methotrexate is actually a medication that is used to treat different types of cancer, psoriasis, and rheumatoid arthritis. The main adverse effect when you take alcohol with methotrexate would be severe liver damage, again, as we talked about ketoconazole before. Talking about the next medication after that would be isotretinoin. So I think all females will be most familiar with it. It's used to treat severe acne. Again, combining alcohol with isotretinoin can again we have seen a lot of severe liver damage in patients. Coming to the next class of drugs, that is monoamine oxidase inhibitors. These are a class of drugs which falls under antidepressants. These drugs, mainly when combined with alcohol, can cause extensive symptoms of
hypertensive crisis.
Yes, they first experience a intensive or rapid increase in their blood pressure, leading to hypertensive crisis.
And that is life-threatening situation.
Yes, exactly. And the last one in my list of examples for today is warfarin. It's a very common medication used for patients after heart valve surgery, or especially it is an anticoagulant which is used to prevent blood clots. And whenever alcohol is mixed with warfarin, it interferes with the effectiveness of warfarin, and it increases the risk of bleeding. So in that case, the patient will have opposite effects like heart attacks, strokes, and then it will be life-threatening. That's the end result.
Yeah, it's correct, because the same enzyme whatever using to metabolize alcohol, same enzyme is used to metabolize warfarin too. And there are some medication which interfere with the alcohol, and I'm sure you made a list of it.
Yes. So we have also made a list of medications that interacts with alcohol. So the first is sedatives and tranquilizers. So in sedatives and tranquilizers, the mostly commonly prescribed drugs are Xanax, that is alprazolam, generic name, Valium, diazepam. So these drugs, when taken with alcohol, there's a serious risk of respiratory depression, overdose, or even sedation, and many other unpleasant symptoms.
Yeah, because you meant all the drugs comes under the benzodiazepam group.
Yes.
And that all the it's like a brain depressant, so CNS depressant, so it can cause sudden death.
Yes.
If we take mixing with together, it can cause respiratory arrest and sudden death. Yeah.
The second class of drugs is antidepressants. So in that, we mainly have the selective serotonin reuptake inhibitors, SSRIs, and also tricyclic antidepressants, or the TCAs. So in these classes of drugs, when we take it with alcohol, already on the first basis, antidepressants causes sedation as the medication as itself. So when you combine it with alcohol, it increases drowsiness, dizziness, and most of it impaired coordination as a whole. Then coming to the next class of drugs, the third class is opioids. Opioids is also it is most commonly used, especially after surgeries, and as we can see in oxycodone and medications like that. But it is highly deadly because when opioids are mixed with alcohol, it can cause severe respiratory distress, coma, or even death.
Yeah.
Coming to the next class of drugs will be antihistamines. So antihistamines is like very common to everybody. We purchases over the counter for allergies or for any other sicknesses that when we go for traveling or stuff like that. So antihistamines, when combined with alcohol, can increase drowsiness and it will make you more impaired as it is. Then the next class would be stimulants. So stimulants can also increase your risk of doing your day-to-day activities, and it also impairs your mental coordination and daily basis
Okay.
stoppage.
Yeah.
Then we have another most important class is the NSAIDs or non-steroidal anti-inflammatory.
Yeah.
So these drugs, when combined with alcohol, can cause gastrointestinal bleeding across the GI mucosa, and also it causes ulcers. So, as I told, this is the same case with NSAIDs also when taken alone. NSAIDs, when you take it alone itself, can cause ulcers. So when you combine it with alcohol, can increase your chances of disturbing the gastrointestinal mucosa and having ulcers.
And with the steroids, same thing. And
Yes.
we need to understand when you take alcohol itself irritate the mucus member, same like
Yes.
medication. So the combination is going to make it worse, and the GI bleed. And I think one more, it's anticonvulsant also, isn't it? The medication, whatever is affecting the brain, it's we mix with alcohol, it is going to be like a more brain. It's work to depress, then it is going to be like a respiratory arrest and death. And any medication affecting the brain should not take with alcohol.
Then it will be really surprising to know that our daily maintenance medications that is used for blood pressure or blood sugar or our daily usage of paracetamol or acetaminophen, Tylenol. So that is also deadly if you take it with. It can increase your chances of liver damage when you take it with alcohol, and that is also not advised when you take these medications with alcohol.
And what about the cholesterol medicine too?
Cholesterol
Isn't it?
medications too.
Yeah. And can you explain a little more about the blood pressure medication? Like I know that we know that the alcohol itself is a vasodilator, and when we take alcohol with the blood pressure medication, it drops the blood pressure more.
Yes.
And to compensate that then our heart rate is going to be going up, end up with a life-threatening situation too. Okay.
Yes.
And as we have to mention that over-the-counter medication, when you mentioned about the over-the-counter medication, not only over-the-counter medications, some aftershave lotion, there's a lot of things, any contain alcohol, you have to take precaution when we take some medication with it. Even nowadays we can get some sweet dishes, cake and all with alcohol.
Yes.
So that's what the purpose of this is. The public should know that anything contained with alcohol, we have to take extra precaution, or we have to let the healthcare provider, your doctor or the pharmacist, about your use of alcohol.
And also, I would like to add on, like several patients when they buy medications, they normally do not read the labels or the monograph that is given to them. So normally, when we ask patients if they need the monograph, everybody will like, hey, I don't have time to read that big paper. But it's really informative, and it has most of the details regarding the medications and the interactions or contraindications that you're taking. So I would personally advise everybody to read both the monograph as well as the labels.
Yeah, that's a good idea, I think, because it's long, we understand, but we have to specify. You don't have to read the whole thing, but at least the interaction for that. Yeah, because the health is very important, our health, and we have to take precautions. Whatever we are putting in our body is going to come out, and that is very important. Yeah, and I hope this video will help you guys. And if you have any question, please ask, no problem. We'll help you with answers. And please watch, share, subscribe, and comment. Next time we'll come with a different video. Thank you
See
for
you next
watching.
time. Bye bye.